Well, welcome. Today we are doing our question and answers with Dr. Kalea Wattles. So thank you so much for joining us. We appreciate it. And she is with Functional Fertility. And I also have to say that we are, for the first time, another first for us. Not only are we streaming on Facebook, we're streaming on LinkedIn, Instagram, and YouTube. So anybody who has questions, please put them in the comment section, and I'm sure Dr. Wattles will go ahead and answer them as we move along. But so first of all, thank you so much for joining us. We just had a fun Instagram.
Yes, thank you so much for having me. I'm really impressed with this technology that you're streaming multiple platforms. It's very impressive.
Right. And we have to thank the person behind the scenes for doing that, because that's definitely not us healthcare professionals figuring that out. Oh my gosh. So can you tell us a little bit about yourself and why functional fertility and your personal journey and how all that started for you?
Absolutely. So I'm a naturopathic doctor by training, and I started in my ND program, and it's a 4-year doctorate program. And in my second year, I got pregnant with my first baby. And that transition into motherhood was the most special, precious, magical time. And I realized how badly I wanted that for anyone else who desired parenthood. So I had this great opportunity. I was in school. I had access to all of this learning and mentorship and classes. So I decided I'm going to dedicate the rest of my student career to really learning about how I can support fertility, motherhood, mamas who are postpartum. So even though I was a non-traditional med student, being in my ND program, I essentially cold called all the fertility clinics in my area and said, listen, please let me in. I just want to observe. I want to see what you're doing. I want to learn more about how the type of care that I can provide, which is largely lifestyle, primary care, really root cause medicine, can support the patients who are going through fertility treatment. And I was so fortunate that 3 clinics gave me the opportunity to be with them. So I was doing fertility intakes. I was watching in the OR as they were doing egg retrieval. I was in there when they were doing IUI and embryo transfer. And I was really able to see the process from beginning to end. And it became so apparent to me that these things that I offer could really help improve outcomes for patients, even if they still pursued, IUI or IVF. I could help them to really focus on their egg health and prepare their endometrium and get their metabolic health in order and make sure that their hormones were healthy. And it was such an eye-opening experience for me. So I spent a lot of time in the fertility clinics. I did postdoctoral training through the Institute for Functional Medicine, where I learned about systems biology. We should talk about what that means here shortly, but was able to combine that into my private practice at Functional Fertility, where now I support women anywhere in their fertility journey. Many of my patients are coming to do preconception care. They just want to be really proactive, make sure their body is ready for a healthy and safe pregnancy, or they're doing IUI or IVF, want to make sure that they're optimizing their outcomes, or they're postpartum and want to support their body so that they're ready when it's time for baby number 2.
So for anybody who's listening, I'm just in awe of everything that you did, your postdoctorate work and calling the fertility clinics, and just the investment of time. I think time as a parent is the biggest investment you can make with anything. So the investment of time that you made, plus of the just going through everything else in the learning. So that is so impressive and just makes you a much more well-rounded naturopath. You were talking about, you said, let's visit this again. What is functional biology? And so let's get into that. And then can you segue from functional biology into, and how is that informing what you're doing for your patients? What are you doing for your patients that's different than just going to an IVF clinic?
Yes, love this question. So I think the beauty of functional medicine, and what I always tell my patients, is it's systems thinking. So we use it's systems biology, really. And what that means is we're looking at all areas of your body and how they're working individually, and then how they're all interconnected. So I'll give you the high level overview of what that means. in functional medicine, we use a tool that's called the functional medicine matrix, and it's essentially a map of your body systems. So when I'm working with patients, I'm collecting their health history, family history, personal history, signs and symptoms that they have from every area of their body, lab work that they have, physical exam, that everything about their health trajectory until this moment. And I am plotting it onto this essentially map of their body systems. That means we're looking at assimilation, which is their gut health. It's the bacteria in their gut, it's how they extract the nutrients from the foods that they eat, it's your microbiome. We're also then looking at what we call defense and repair. That's your immune system. It's chronic inflammation. It's history of infection. So, really, how is your immune system responding to the outside world? We're looking at energy, and that really speaks to cellular energy. And in my world, that means mitochondria, which is a whole other conversation, but mitochondria are my favorite. They're the most important little organelles that generate cellular energy. We can think of them like cellular batteries. And we need cellular energy to power the most important fertility processes, which are ovulation, fertilization, implantation, and then early embryo development. So, part of my work is making sure that you have that cellular energy available. We're also looking at biotransformation, and this really speaks to how we engage with environmental toxicants, how we process them, how we remove them from the body. If we have any genetic predispositions that make us more vulnerable to that type of exposure, we're thinking about that. Next, we have transport. And this is really all about messengers. So, this is our blood flow, it's our lymphatic flow, and then also glucose transport falls under this category. So, we can think metabolic health here. Then we have communication, and this is one of my favorites in the fertility world because it's all about hormones. So that could mean sex hormones like estrogen, testosterone, progesterone. It could also mean insulin is a hormone. It could mean our thyroid hormone, prolactin, DHEA, all of these amazing hormones that communicate with each other. And then there's structural integrity, and that's where I think our work collides a little bit because structural integrity is I always say it's tiny structures like our cell membranes, all the way up to big structures like our skeleton or our organ systems. And so I am identifying what I call clinical imbalances in each of these areas. And then we're pulling in the assessment and the treatment that we need to address what that specific body is telling us, where those imbalances are. So I think that's what makes my practice different. And patients will usually tell me, wow, I have such confidence knowing that you're not just kind of throwing whatever protocol at my care. We're really thinking about what my unique body needs and where my own clinical imbalance areas are. So it's personalized medicine, it's precision medicine, and I think it's where functional medicine and functional fertility really shines.
I love that, the personalized medicine.
Yeah,
Wouldn't that be wonderful if we could have that everywhere?
it's the dream. I'm working on it, Sharon.
So you mentioned a couple of things which Clear Passage also works on, and it's kind of like blink, blink, blink. Gut health, microbiome, immune response, inflammation, because all of these also affect the adhesions, which we'll talk about structural integrity later. But
Yeah.
do you want to do a little bit deeper of a dive into gut health and immune system and inflammation?
Sure.
And why all of that's so important?
Yes. I mean, it's like an old naturopathic philosophy, right? That all health begins in the gut, and then conversely, disease begins there too. So we think about this all the time. And something that I think about constantly in my practice is intestinal permeability or leaky gut, right?
Yeah.
Because our gut barrier should have good integrity, meaning it's a filter and it's filtering appropriately. But when our gut barrier is damaged by environmental toxicants or foods that we're sensitive to, or we're taking a little too much ibuprofen or alcohol, or any number of things can damage that gut barrier. And compounds from inside our intestinal tract can traverse that intestinal barrier, enter systemic circulation where they activate our immune system and cause this whole inflammatory cascade. And I tell my patients, once we have all these inflammatory messengers in the bloodstream, they can go anywhere. Once things enter systemic circulation, they can go anywhere. And that includes our reproductive organs. And we have this interesting research to show that when there's more intestinal permeability, we have more inflammation in the ovaries. which can impair progesterone production and can cause a wasting of the tissue there. So we're actually kind of wasting away our egg cells. And it's really something I think about often when I see like a short luteal phase. What's going on inside the ovary? What's going on with progesterone production? And then we also see that it can affect the endometrium, that inner lining of the uterus, if there's more systemic inflammation, more endometrial inflammation, and that can affect things like endometrial receptivity and whether a fertilized egg has a nice, fluffy, healthy landing spot to hold on to. So I'm really thinking about this line of really a bidirectional communication between the gut and our reproductive organs.
I could sit and talk to you forever. We're talking the same science and
fun.
it is so much fun. I've got my geek on. It's really enjoyable. So we've talked about the gut permeability and the inflammation. Stress is a huge factor to
Yes.
all of this.
Yes.
But what do you think is the biggest factor of infertility that you're seeing?
Gosh, I think about this all the time. And to be quite honest, I don't think it's just one thing, but I do think that we are living in 2024, we have so much stress. I blame hustle culture quite often, right? Like this go, go, go. Our adrenal glands are so taxed. We all have raging cortisol pumping through our bloodstream that can impact ovulation. We have all kinds of toxic exposures. We're busy and we're rushing and we're not eating those antioxidant, nutrient dense foods. I think it's probably a combination of every part of that matrix I just talked about. We have imbalanced gut bacteria. We're inflamed because our gut is leaky. We have low cellular energy production because of all of the pollution and chemicals that we're exposed to. We don't have good blood flow because we're sitting at a computer or we're commuting all day. So I think the biggest issue with fertility is the modern lifestyle, really.
I agree. You said go, go, go. And I was just playing with this the other day. Even when I have downtime, the system doesn't know how to stay still and just enjoy that downtime. And I'm a meditator and I do all that kind of stuff. So I'm highly alert. So think about all those people that are just so used to going from phone to this, to the computer, to TV, to children, and just not even knowing how to turn off. It's crazy.
And when you're accustomed and acclimated to that level of stress and then you have some downtime, it's uncomfortable. It's actually uncomfortable to sit with your own thoughts, to feel your own heartbeat. It's hard and you have to learn those skills, but it's a journey.
So when a couple comes to you, what can they expect, on that first treatment, throughout all of treatment, and how is that going to look a little different than your typical Western model?
Yeah, great question. So everyone who comes to me, this is not true for everyone, but I usually start with the female partner because it's usually the female partner who reaches out to me first, and we'll have her initial visit. And so everyone who comes to see me, I have them do a preconception panel in blood work so that we have that to review the first time I see them. That panel is pretty comprehensive. People will joke sometimes that they're getting their blood drawn and the phlebotomist will say, you must have a naturopathic or functional medicine doctor. Quite a lot of blood work. So I do the first round of blood work on cycle day 3 specifically. The reason why we do that is because on cycle day 3, that is when estradiol and FSH are at the lowest point in the cycle. And that's where we have the research to show that those numbers correlate with things like ovarian reserve. So on cycle day 3, I have my patients go in for estradiol, FSH, so follicle stimulating hormone, luteinizing hormone. They do DHEA sulfate and testosterone. They do fasting insulin, prolactin. They do a lipid panel. They do high sensitivity C-reactive protein, which is my favorite inflammatory marker. They do a comprehensive metabolic panel, which is going to look at liver function, kidney function, electrolytes. We're also doing GGT, which is kind of a more advanced liver marker that helps me understand their overall body burden of toxicity. We're doing uric acid, we're doing homocysteine, B12, ferritin, an iron panel, We're doing a full thyroid panel. So TSH, free T3, free T4, thyroid antibodies. We're really looking at multiple parameters of hormonal health, inflammatory, some nutrients, metabolic markers, so that I can understand which areas of their body need to be cared for most urgently. So that's happening on cycle day 3. And then I'm having them track their ovulation. I usually start with just using the luteinizing hormone urinary test strips, and then we're getting them to the lab 1 week after ovulation to measure their serum progesterone so I can understand if they're ovulating, what's the level of progesterone they're making. So we get all kinds of blood work done. And then my patients fill out a series of questions that is called the medical symptoms questionnaire. And it checks in on all of their body systems because I want to always correlate what the patient's labs say with how they actually feel. So we're collecting all that information, and then we have a 1-hour intake appointment where we review those things. And then we always talk about all of the modifiable lifestyle factors, which is sleep, stress, nutrition, exercise, and relationships. And so I always have my patients leave that initial visit with a lab review, supplement review, all their lifestyle factors accounted for. And it's really a comprehensive root cause, full person approach to supporting not just their fertility, but their whole health. My focus is reproductive health, but I always say the things we do to support your fertility, right? The healthy blood sugar and the controlling the inflammation. This is setting us up for a healthy and safe pregnancy, but also the longevity to enjoy this family we've worked so hard for.
Oh my gosh, sounds phenomenal and comprehensive and and scientific. You're getting down to that root cause and to the very specifics of it.
Yeah.
So yes. You were talking earlier about structural integrity, and I know there is a lot of things that you were talking about that you test for that Clear Passage helps. How do you see how Clear Passage helps with structural integrity and some of the work that you do?
Yes, exactly. So I think this is the area where I invite the most collaboration into my practice and why I'm so grateful to have Clear Passage to make that referral, because structural integrity, I feel like to really make a difference, you've got to get your hands on someone. So I was trained as a massage therapist and as a craniosacral therapist. So I have a little bit of that background, but my practice is fully virtual these days. So I need to refer to the professionals on this one. And I love being able to send to Clear Passage when I suspect that there's adhesions that are the root cause of someone's, for example, unexplained infertility. Because I have a lot of patients, they do their big preconception panel and it looks beautiful. I see both partners. Their lab work looks beautiful. Semen analysis looks beautiful. But 6, 9, 12 months are going by and they're not getting pregnant. And so I really try to be proactive in my practice, addressing some of these adhesions if I think that's the issue. And so we talked a little bit about the communication area of the body. And I always think about blood is the route that allows our different organ systems to communicate, right? Our brain and our ovaries and our adrenal glands, we communicate by putting chemical messengers into the bloodstream, and then those chemical messengers are delivered to their target organ. They can only do that if the flow is non-obstructed. So I think about adhesions like roadblocks or speed bumps that are preventing those messages from being delivered. That means hormones, it means nourishment from the blood. So this is a real area where manual therapy can really support my fertility patients.
Thank you. And we've had some good results with that too.
Really have.
Even with your patients.
Yeah.
And not only is it allowing the hormones and the neurochemicals to go into the bloodstream, when we allow better motion, we're actually allowing better function, which is allowing better hormone production too. So you got to have better hormone production before it even goes into the blood.
Yeah.
So.
And I also think about the way that your work, for example, can help people with their menstrual pain. And sometimes it's like, I want to engage in all these healthy behavior changes. I want to change my exercise routine, or I'd like to change the way I do meal prep, but I'm so fatigued and I'm so exhausted because I'm in this chronic pain for so much of the month. Once their pain is better, they're able to more meaningfully engage in these behavior changes. And then it's just a snowball effect of healthy habits. So I think there's probably layers upon layers of how the therapy is helping people.
And I think between you and I, as people start to invest in their well-being, right?
Mhm.
And you start to feel better, you're making this investment, and all of a sudden you're realizing there's so many other things that you could be doing. So if we're going to start with Dr. Wattles, and we're going to do a functional fertility, and okay, so now I'm eating a little bit better, I'm taking a supplement, oh, now I can work on adhesions, now I can have a better lifestyle, now I can realize I don't need so much stress in my life. But every little investment that you make has this huge compounded effect for the rest of your life, not just like you were saying, not just for pregnancy, but for every aspect of your life.
Yeah, absolutely. And you just made me think about, I talked about this kind of map of your body systems in all these areas. And I think about them as a web. I mean, that's how we're trained in functional medicine is you have all these body systems, but we can't think about them independently in silos. We have to think about how they're all connected. So if you visualize in your mind a spider web, right? If you tug at any point on that web, it's going to change the structure of the whole system, right? So for example, when we change someone's structural integrity and improve their structural integrity, we see benefit with their assimilation and with their transport and their communication. And so there's really widespread effects. And I always tell people when we're tracking their body systems like that, it serves a couple different purposes. My ultimate goal is to make sure that every single one of those body systems are supported. So when we kind of use this map, it's also an audit to say we haven't missed anything. And how often do our patients with unexplained infertility say, I just want you to turn over every stone. Please make sure we haven't missed anything. And it allows us to do that. Also, I'm really dedicated to the therapeutic relationship where my patients know why I make the decisions that I make. So, if we plot out their matrix and we see all this dysfunction in structural integrity and I say, wow, this area of your body is really imbalanced, I'd like to send you to clear passage. It's clear to everyone why I suggested that. There's no mystery about it. The thought process is very clear because we can see that that's the area that needed the most support. So I just think it's, really motivating to know that recommendation was designed just for you.
Very, very patient specific.
Yeah.
Absolutely. Yes. Yes. I want to let the person who is running the show that I do not have any comments showing up, which might be nobody's commenting. So if you would like to make a comment or you would like to ask a question, please type it in. If there's a whole host of them and I'm not seeing them, if Heather, you can start typing them in so we could have them show up, that would be great. You asked me this on our Instagram Live. What is the best part of your job?
Wow, just like you, it feels like there's so many good parts of my job. I would say it's very satisfying to me when someone comes and they have had this diagnosis of unexplained infertility, right? And really, when someone receives that diagnosis, it means that they are ovulating, that the semen analysis was normal enough, and that they have at least one tube open. But as we've talked about today, there's a whole host of other things that can be going on that can impact their fertility. So when I receive someone who has, I think now maybe internalized this story of something's wrong and it's a mystery, and then we do this assessment and we find some clear reason why their fertility has been impacted and we're able to correct that. It's so satisfying because they're able to rewrite that story and say, this isn't just, I'm not unlucky. It's not that bad things just happen to me because I'm a bad person or I've done something wrong, or all of these stories that we tell ourselves. It's, oh, there's something going on with my physiology that's measurable. And now we have some action steps. And it's just so reassuring and motivational for both parties, the patient and myself. And I'm always so thrilled when that happens. And I will also say, full disclosure, I can't always figure it out, right? It's not always something specific that I find. But when we start supporting all of those body systems, it's successful quite often.
Oh, so is there anything that you're currently working on or studying or would like to tell us about so we can go learn more?
Yeah. I'll answer this in two different ways because I think there was two different things I could say. What I'm learning about and having such a good time learning about is the vaginal microbiome. I think this is the next, maybe the future of reproductive health science and figuring out how the vaginal microbiome impacts endometrial receptivity and even IVF outcomes. So that's where I'm spending my time reading about. And when I have my downtime, Sharon, and don't know how to handle it and have to go Google something, it's the vaginal microbiome that I'm learning about.
I'm writing it down.
Yeah. Now you'll be doing the same thing, research deep dive. And then what I'm working on in my practice, I have an online program that's called the Functional Fertility Blueprint. And essentially I created this on-demand program because I realized like people are all over the world and maybe they don't have access to see me one-to-one. Maybe it just isn't working out. And so I tried to take that whole functional fertility body systems model and create a program. So it's an 8-week program that helps people to identify, build their own map of their body systems, identify which areas need the most support. There's videos for each of those body systems. We talk about reproductive longevity and protecting your fertility into the future. We talk about supplements, all the lifestyle factors, male fertility. So I joke, it's really everything in my brain put into an online format. And so we have a new offering of that program coming up soon. And I just think it's a great opportunity for someone who maybe wouldn't see me one-to-one to get everything right in one place.
So how long, is it a multi-week program? Is it put into little pods? Yes. Okay.
It's 8 modules. It's 8 different modules and it's on demand. So you can work at your own pace, but there are live elements throughout. So what I learned when I beta tested is that, and I think this is not unique to fertility, but it is very strong in fertility, that the community aspect is so healing for people. So I try to create many touch points, whether it's Zoom calls, there's an online community where women and the participants of this program are making lifelong friendships because they're connecting over what they're learning and what they've been through. And I think that is such a powerful aspect of any program. But fertility is like, there's so much grief and pain, but also hopefulness that's wrapped into it. And so they're really forming deep relationships there.
We have something very similar. It's just popping to the top of my head. 2 of my infertility patients became good friends because of their time at Clear Passage. And they weren't even here. They weren't even at the St. Louis clinic at the same time. They met through an online group, and one said, they opened my fallopian tubes. I'm so excited. So the other person came, and they just kept communicating and texting and talking. And both of them ended up pregnant, and they literally are lifelong friends. It's amazing.
Community is medicine.
Yes. Yes. Oh my gosh, I love collaborating with you. I love putting our heads together about patients. I love getting our geek on about microbiomes and structural integrity and the web that keeps pulling. So tell people how we can find you. How do we get in touch with you? How do we find you?
Absolutely. So to learn about my one-to-one or my group offerings, you can head over to drkaleawattles.com. That's my website where you'll find everything that you need to know. And then I also always recommend come on over to Instagram at Functional Fertility is where you'll find me on Instagram. I post fertility tips and videos and all kinds of fun resources multiple times per week. And it's really me. I always tell people it's really me there. So if you need something, send me a message. And I look forward to connecting with everyone.
Thank you so much. And this has been a Clear Passage question and answer. So you can get a hold of Clear Passage at www.clearpassage.com. Give us a call at 352-336-1037. 1433. That's all in your chat. We have locations in Nevada, Texas, Missouri, New York, Florida, and London. Thank you so much for your time today. I really enjoy being with you, and I always learn something every time we talk. So thank you so much.
Thank you so much.
Have a good day, everybody.